The Messiah calls them from all over, the hopeful, sick from diabetes, arthritis, cancer, and every other disease and ailment known to mankind, all of them seeking the Messiah that can divine what ails them and cure them. But like any faith healer or medicine man, there is something going on behind the curtain.
Of hands.
And what I always do here is I go girl, boy, so that I don't get into trouble here. All right, this young lady right here. Since somebody was pointing at you, so I figured. Do we have a microphone for folks in the audience? Is that so that everybody can hear the question? Okay. I think there's somebody coming from this direction. There you go. You can just hand her the mic.
Good afternoon, Mr. President. I'll try not to cry. I'm trying to figure out what I can do currently. My situation is I had renal cell carcinoma in '98 that was radiated because my dad was dying of colon cancer at the time, and I was his healthcare surrogate on his living will. So I could not be tied up having my kidney removed. So they did radiation procedures to kill the tumor then, and I had insurance and everything was paid for that. But basically, because of the damage that the radiation did in things, I'm no longer able to work, and I have no health insurance. Now I have a new tumor. I have no way to pay for it. The doctors will not see you without paying $100 or $150 to get into their office. I can get checked into a hospital, and under their engineer program, they will run tests and release me, but that costs a lot of money. So currently, I basically, Social Security will not give me disability because renal failure is no longer a qualifying factor under Social Security currently. I cannot get Medicaid through the state of Virginia because you have to be qualified. You have to be considered disabled through Social Security to qualify for Medicaid in the state of Virginia because I have no dependent children at home. It's just me. I get food stamps, but that's it. And I'm just trying to figure out how I'm going to make it 9 years till I'm qualified to get my regular Social Security. Now that I have a new tumor and have nowhere to treat it.
Well, here, come on over here. First of all, we're going to find out what we'll get your information and we'll see what we can do to help you. I don't want you to feel all like you're alone on this. All right, it's a guy's turn now. All right, so ladies, you keep your hands down. All right, this young man right here. If we can get a mic, yeah.
Great. I've been hearing a lot.
What's your name?
Jason Rosenbaum.
Hey,
nice
Jason.
To meet you.
What do you do, Jason?
I work for a group called Healthcare for America Now.
Mm-hmm. So I think he knows something about healthcare. This is like.
Obviously I read the news a lot, and I've been hearing a lot about the price tag of health reform and how people are very concerned that it's going to cost $1 trillion or we're trying to keep it under a certain number. I'm most concerned about making it affordable, folks like me, the American people. So what do you, and like you said, you're committed to making this deficit neutral. So I hope you could talk a little bit about affordability and what your plans are.
All right, Mr. President, I'm getting the high sign. So how about one more question from our
One more
wonderful
question
audience.
from the audience. Let's see. It's a girl's turn, isn't it? I think so. Ooh. This young lady right here.
Hi, Mr. President. I'm a member of SEIU, and I'm down here in Fairfax County working on Change That Works. What can I do as a member of the union to help you with your reform bill?
Well, I appreciate the question.
No doubt this audience was not stacked with plants and shills at all, and represents Americans and the questions they have 100%. We are all either volunteers for Dear Leader Zero, or we are lobbyists working on Dear Leader Zero's agenda, or we are employees of a union that spends our dues to support Dear Leader Zero.